So blepharitis is chronic inflammation of eyelid margin. It is divided into two types, the anterior and the posterior. Anterior is further subdivided into ulcerative blepharitis and squamous blepharitis. However, posterior blepharitis has one subdivision, that is meibomianitis. Talking about their definitions, ulcerative blepharitis is chronic or acute infection of the lash follicles, which is caused by Staph aureus or Staph epidermidis. Talking about squamous blepharitis, it is defined as a disorder of the glands of Zeiss and mole. Now, what happens in squamous blepharitis is that these glands of Zeiss and mole produces neutral lipids in their regular production. But if this is affected by Corynebacterium acini, it will convert these neutral lipids into irritative fatty acids that will cause inflammation and eventually squamous blepharitis. Talking about meibomianitis, it is defined as a diffused inflammation of meibomian glands characterized by hypersecretion of lipids. So hypersecretion of lipids by the meibomian glands will eventually lead to meibomianitis, which is the posterior blepharitis. Now let us talk about their clinical features, that how can we differentiate them in terms of their history and presentation, though we have already differentiated them in terms of their definition and etiology. Ulcerative blepharitis presents in the form of swelling of the eyelid margin, glued eyelashes, yellow crusting, and matted eyelashes. Now this infection will result into gluing up of the eyelashes. Then talking about squamous blepharitis, it will present in the form of a deposition of whitish material on the eyelids, that is dandruff-like material. It will have shiny margins and the eyelashes will become greasy or very oily. So this will differentiate between ulcerative and squamous blepharitis. Talking about meibomianitis, now it will present with a characteristic white frothy secretion on the eyelid margin. Now eversion of the eyelid will show the yellow shiny vertical lines through the tarsal conjunctiva. That is actually a clinical diagnosis of meibomianitis. Now let us talk about what complications will ulcerative blepharitis cause. Now it can cause loss of the eyelashes, misdirection of eyelashes, conjunctivitis, and toxic punctate keratitis. I will talk about these in their respective chapters. This was ulcerative blepharitis. Now let us talk about the squamous blepharitis. It will cause metarosis, trichiasis, poliosis, and conjunctivitis. Talking about the last type, that is meibomianitis, it will cause papillary conjunctivitis and punctate keratitis. Now talking about the treatment for ulcerative blepharitis, only eyelid care can cure in some patients. However, in other patients, we might need antibiotic ointment that include ciprofloxacin, or even the use of topical steroids can be prescribed. Now talking about the squamous blepharitis, again, eyelid care can cure in most of the patients, but topical antibiotics and steroids can also help. Thirdly, again, in terms of meibomianitis, eyelid care and steroids will help, though systemic antibiotics are required. They include doxycycline and erythromycin. So let me show you a diagram of blepharitis so that we can have an image in our mind that how the patient will present and what questions we will ask to differentiate between different types of blepharitis. So as you can see, on one side there is a healthy eye and it is showing normal eyelid. On the blepharitis side, the eyelid is shown to be swollen and reddened, and there are scaly scabs, and this is because of bacterial infection, and this is a characteristic picture of blepharitis. So I hope now you have a much better understanding and differentiation between different types of blepharitis.